All right, the Afreximbank, known for its financing, promotion, and expansion of intra-Africa and extra-Africa trade, has invested in Nigeria's healthcare system to boost the health ecosystem in Nigeria during the Africa Health Forum 2024. Arise News health correspondent Olije Okpera reports from the Africa Medical Center for Excellence Forum 2024, held in the FCT, Abuja, Nigeria.
The chairman of Afreximbank signing a $1 billion memorandum of understanding with the federal government of Nigeria to support the Africa Medical Center for Excellence (AMCE) in building a world-class facility in Abuja, Nigeria's capital. This is one amongst 5 other medical centers to be built in Africa. Why this investment in the healthcare sector?
In today's world of ever-rising complexity of health challenges and increasing frequency of epidemics and pandemics, access to quality healthcare is essential to building a healthy population and labor force for continental development. When the Africa Medical Center of Excellence initiative was first conceptualized in 2014, the concern was inadequacy of healthcare facilities to deal with non-communicable diseases, an unacceptable situation we found ourselves in Africa, given the stark predictions that non-communicable diseases would overtake infectious diseases as Africa's most troubling health challenges by 2030. Although Afreximbank launched its 4th strategic plan spanning 5 years, 2012 to 2016, was launched in 2012. The idea, the initiative to push this project can be traced to 2013. In 2013, I fell seriously ill and nearly died. I was evacuated to King's College Hospital, London, after we had, at our bank had, checked everywhere in the world to find where they would get the best expertise for the kind of condition I was diagnosed with. 3 independent checks all went back to one named Professor Ghulam Mufti. So we contacted Professor Mufti, and he was kind enough to agree to receive me immediately. And he not only agreed to receive me, he also started giving advice to the doctor who was handling my case then in Cairo, as we prepared for the evacuation. All through that period, through 2013, when I was in the hospital, we became very good friends. And when I recovered, the issue was, if I didn't have the support of Afreximbank, if I didn't have the opportunity to come to King's College Hospital in London, if I didn't have the opportunity to find a Professor Ghulam Mufti, no matter what it cost, I wouldn't be alive. The problem of the healthcare situation we find ourselves on the continent is compounded by the fact that only 48% of Africa's 1.4 billion people have access to essential healthcare services. Based on the story I just told you, and the inadequacy of healthcare facilities on the continent, it's obvious to anyone who is interested in making a change on the continent, that something has to be done. Distinguished ladies and gentlemen, addressing these deficiencies is indeed a continental emergency. And this forum is one of many initiatives being deployed by Afreximbank Group to draw attention to the matter and emphasize the urgency.
Afreximbank is therefore investing in the Medical Center for Excellence to establish a stellar facility to cater to the very purpose of tackling the poor health infrastructure in Nigeria and Africa in general.
Professor Orama, we really are very glad that you are a key champion of this on the continent. And we see Nigeria and what we're doing here has really important connections to what is a current across the continent of Africa, and I will say globally in the post-pandemic era. This US $1 billion healthcare value chain program. And I think there are several actors that are interested to participate. And the program will encompass financing, support and investment, infrastructural development, human capital development, research and innovation, and technology, policy, regulatory and quality improvement efforts, market access and investment promotions, environmental and sustainability initiatives, etc. And through the program, we'll increase domestic manufacturing by boosting the local production of essential pharmaceuticals, diagnostics, vaccines, biologics, other biologics beyond vaccines, medical consumables, and devices to reduce our dependency on imports and enhance our health security. In fact, as we speak, we've got a large mission here to establish a very large diagnostic facility in Nigeria as part of this effort. That's the second in just the last couple of months, and more are on their way.
The CEO of the African Medical Center for Excellence says he is optimistic about the partnership with Afreximbank and hopes to reverse medical tourism. The Chief Medical Officer also highlights key plans of the medical facility.
I thank Afreximbank and President Orama for the incredible vision, determination, tireless commitment, and dedication of resources without which this project would not exist. Our training and education programs will be another cornerstone of our strategic presence. We believe in empowering the next generation of healthcare professionals through collaboration with existing medical schools, nursing programs, and allied health institutions, in addition to our own recently announced development of a new medical school with our esteemed academic partner, King's College London. We will build an army of well-trained professionals who will become the backbone of healthcare excellence in Nigeria and across the continent.
We are determined to provide quality end-to-end care in the three recognized, prioritized, non-communicable areas of oncology, cardiology, and hematology. We believe that we would be able to reduce brain drain if we get to employ some of the healthcare workers that are heading out, because we provide the enabling environment, and we would also influence reversal of the drain.
The World Health Organization reports that Africa bears more than 24% of the global burden of diseases, but has access to only 3% of health workers. Nigeria's healthcare sector has witnessed massive migration of healthcare workers to other continents, leaving the sector with skeletal services, poor infrastructure, poor staffing, lack of equipment for the diagnosis of ailments, poor remuneration packages for healthcare workers, lack of essential drugs, and more.
Nigeria is still, is still very backwards in terms of the way they perceive nursing profession. Back in London, nursing profession is actually another health profession within the health. We have equal stand with any other professions. And if you look at nursing in London or in the UK, many of the chief executive officers of the hospitals in the NHS are actually nurses. So things have moved on. We need to upskill nurses. We need to change mentality. We need to change mindsets. And I'm really hoping that that's what we're going to offer in Africa Medical Center of Excellence. My plan is that now we are working with King's College London. We're going to bring research, innovation, evidence-based practice where nurses will be able to stand tall, shoulder to shoulder with any other professions in Nigeria and be able to actually debate medical condition, medical output using evidence-based and using research.
We are going to appeal to all spectra of the Nigerian population. We're not just being set up for the rich, we're going to be set up for people that have health insurance as well as fee-for-service. So AMC is for all Nigerians and West Africans.
The partnership with Afreximbank is not just to establish a state-of-the-art facility, but also to train healthcare workers.
We have to be honest, too many wealthy Nigerians are travelling abroad for their healthcare. There's a billions-dollar market here to tap into that can finance that ecosystem. And too many Nigerians, professionals, are going to other countries for their medical careers, and I include the UK in that risk of a brain drain. And Madam Dabiri, we need to work together on this with NIDCOM on a reverse JAPA of Nigerian health professionals.
This partnership with Afreximbank to build the Africa Medical Center for Excellence is to begin operations from 2025. Afreximbank is coming to the rescue at a time when the Tinubu administration is focused on revitalizing the healthcare sector in Nigeria for Nigerians and Africans.